Hi, my name is Dr. Jennie Byrne. I'm a psychiatrist and neuroscientist by training, and I currently work as an advisor, and I have a private practice which is called Constellation PLLC. I think the single most important thing about objective testing for adult ADHD is that it gives you a objective metric that you can treat to target. So for example, in my practice, I work with a lot of folks with ADHD. We'll do an objective test like QbCheck and we'll see where they're at. And then we'll also recheck them on medication. So it's similar to taking blood pressure. If you have high blood pressure and your doctor gives you medication, you want to recheck the blood pressure to know whether it's working or not. So I like to use objective testing in that way. And I think a lot of people don't realize that that exists for ADHD. ADHD assessment has always been tricky, in part because the definition does change over time. The more we learn, the more science we have. It does change somewhat over time. The other thing that makes it very difficult is the amount of misinformation around ADHD as compared to other conditions like depression or anxiety. I find there's way more misinformation out there that people are listening to. And then the other important piece is that ADHD in adults, especially if you haven't been diagnosed early in life, doesn't travel alone. So it also will travel with things like depression or anxiety, substance use, trouble with sleep, physical health issues, and sometimes um, untangling all of those friends that travel together can be tricky. Some of the biggest misinformation that I have seen is that ADHD doesn't exist, or we're all a little ADHD, or our computers and our screens and our devices are making everybody ADHD. And from my understanding, again, as my training as a neuroscientist and in my clinical work as a psychiatrist, I view ADHD as a brain variant. So it is an anatomic variant that probably 5% of the population has. That is not something that happens because of our screens. So, yes, we can have attention symptoms because of screen use, but that is different than having a brain variant that you are born with and that you have your entire life. So, in my practice, and I've been doing this for decades, what I have learned works best to make an assessment for ADHD is a three-pronged approach. So I do the clinical interview, which is what most docs or psychologists or others will do. And that's a conversation where I'm talking about history, symptoms, etc. But in addition to that, I do objective testing with typically a computer-based assessment. QbCheck is an example of that. And that helps me get to like the neurophysiology. So it looks at things like reaction time variability, micro movements of your head, and a pattern of responding that is really more based in your neuroscience. So I use that. But then the third prong is also an extensive rating scale on your lived experience. Like, what are you experiencing with your executive function? And I get that from somebody who knows you well, too. So I get your experience and somebody who knows you well, their experience of you. So for me, a diagnosis is really taking all three prongs and looking at them together in the big picture. So I don't just look at a digital test and have someone look at the computer and say, yep, check the box, you have ADHD or you don't have ADHD. It's really part of that picture. And I would say, again, using the analogy of blood pressure, if I was a primary care doctor, somebody sits in my office and they have a high blood pressure, I don't just put them on medicine right away. They may have a high blood pressure because they just ran through the parking lot and they sat down. They may have high blood pressure because there's white coat syndrome and I'm a doctor, and so your blood pressure goes up. No, I'm going to check it over time. I'm going to take their clinical history. I'm going to use a lot of things in my decision making. I may order some lab work. I may do a physical exam. I don't just give someone medication for blood pressure because I checked it once in the office. And similarly for ADHD, I wouldn't do a computer test and then just hand somebody a prescription. So it's really like a key element in the clinical judgment and decision making process. Yeah, I don't know why people don't really, I think they just don't know these tests exist or how they're used. And so they're very mysterious and hopefully, getting the word out will help to like demystify that a little bit. And using a digital tool, I think it's part of the big picture. So I think it's a critical part to get at like the brain part, again, that neuroscience part of like, I used reaction time, for example, or micro movements of your head. These are things that you are not consciously controlling. These are on autopilot based on the way your brain is working. So I feel like to do research on our brain, we should use as much scientific data on the brain function as we have. And what's great about these digital tests is it gives us a snapshot into a real person, you know, sitting at home or in an office taking this test, as opposed to someone sitting in a laboratory or an academic center. So they really let us use data from real world in a way that I don't think we were able to do before. So again, I'm a scientist, so as much science as we can get, the better, right? Like psychiatry is notorious for not having a lot of science. And so the fact that we have tools now where we have some science is very exciting to me. Yeah, so I'm actually writing a book right now on the topic of ADHD. And one of the things I wrote about and looked at was that right now ADHD is framed as a disorder. And I understand why, right? Because it's important for people to get the treatment they need. And there's kind of this history that we have to call it a disorder for people to have the right to treatment, which is a little bit of a philosophical tangent. But the reason it's important is if it's a brain variant and not a disorder, it's really more about understanding that brain variant and how to bring out the best of that brain in different situations, as opposed to making everything a disorder. So, one of the things I don't like about research is it frames everything as a disorder. And if you read the research papers, everything, all the language is very negative. And I think when you are somebody with lived experience around ADHD and everything is negative, all the research is negative words, all the press is negative, it's a disorder, it's negative, negative, negative. That actually creates a lot of shame and stigma for some people. And I don't think that's necessary. I think there's a way to do research where we're looking at differences in brains as opposed to, good versus bad, normal versus disorder. And again, there's a whole history of why we use the term disorder, and that there's a lot of good reasons for that. But I think we talked at the beginning about misinformation. A lot of the misinformation that comes out is because we may be framing a brain variant as a disorder. Yeah, I think people don't, we're, especially in the American culture, we don't look at our history very often. But if you look at the history of psychiatry back into the middle of, the 1900s, the reason that we started calling things disorder and having the diagnostic statistical manual was because the Freudian approach to psychiatry was notorious for saying there were no diagnoses. Everybody's different, there's no diagnosis, and it made it impossible to do research. So the framework shifted into a more biological perspective to try to categorize things and to try to create names for things. And that's where this terminology around like these disorders came from. So there was a really good reason for it because it was a reaction to something which really was not helpful at all. But it leads us to the current situation, which I believe we can do a better job. I think we can evolve the way we think about these things and the way we talk about them. That I discovered this misinformation that's still maybe even getting worse on in the last 20 years that I've been doing this and working with a lot of professionals. So people who are very high achievers, who have ADHD, who are very stigmatized right now. I decided to write a book on the topic. And what I'm hoping is this book will reach people who maybe know they have ADHD. Maybe they don't. Maybe they wonder, do I have ADHD? Maybe they have a friend, family, colleague. Maybe they're a leader or a manager at a professional setting where they manage people with ADHD. I'm really hoping that I can share people's lived experience stories, as well as my own experience, as well as some neuroscience and help to change that narrative. We talked about how it's a very negative narrative. I really hope to shift the narrative into a more positive, more non-judgmental and clear-eyed view of what ADHD is for, strengths, challenges, the whole thing, so that people don't feel so shamed and stigmatized, and they can learn more about their own brain, whether they choose to take medicine or not, just to learn more about themselves and to get curious and to be able to make those changes in their workplace. Because I think that if we can learn how to work with ADHD brains in our workplace, it actually brings a whole level of opportunity and possibility that maybe we don't even have right now. To say the one thing that's been on my mind for a couple years has been around telehealth and controlled substances. Part of the stigma around ADHD has to do with the fact that one of the types of medicines are controlled substances and are controlled by the DEA, which is basically not a health organization, it's a policing organization. And the DEA exists for a very, very good reason. It's very important that the work that they do, but they are not a healthcare organization. They police. And so because it's policing, it has created a lot of confusion, stigma for ADHD folks. So I want people to know that, first of all, if you have an ADHD brain, it doesn't mean everybody has to take medication, first of all. There are a lot of other ways that you can thrive without medication. But if you choose or you need medication to thrive in your environment, there are medicines out there that are not stimulants. So it's big misinformation out there that the only treatments are Adderall, Ritalin, other kinds of stimulants. There are plenty of other treatments. Um, and I would love for people to understand that telehealth is not a type of medicine. Telehealth is a way to work with somebody. You could work with them sitting in a room. You could work with them on a video screen. You could work with them on the phone. I even work with people via text and email and videos and things like that. So it is just a way of working with people. It's not inherently good nor bad. It is just a way of communicating with another person. So I would really love people to understand that telehealth is not good or bad. It really is just a way to communicate. And sometimes it's a great way to communicate, and sometimes it's not a great way to communicate. But it doesn't equal clinical quality. You could sit in the room with somebody and have a very poor quality interaction with low clinical quality sitting 5 inches away from that human being. And you could have a very high quality clinical action on a text message. So the vehicle to communicate really is not the point. It's really the way that you communicate with that other human being. So I wish people would stop talking about telehealth is good or bad, or we should have more or less. The point really should be about the communication and the quality of that communication as opposed to how that communication is happening.